Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
If babies came with a manual, our lives would be so much easier. Instead, not only do they not come with a manual, they evolve into little terrors during their toddler years. Yes, I'm talking about the terrible twos and everything that comes with it. Tantrums, food refusal, picky eating, and terrible sleeping habits. I'm going to try to help you navigate through this and give you all of the advice that I can to help you manage these very difficult times and help you navigate, and more importantly, hopefully prevent some of those tantrums on this episode of Ask the Doc, No Appointment Needed. Hi, I'm Dr. Scarlet Constant, board-certified pediatrician and founder of Constant Care Pediatrics. Welcome to Ask the Doc, No Appointment Needed, a show where we ask you viewers to send in your questions so that I can answer them for you in real time. Today, I'm going to help you de-escalate and even prevent tantrums. We'll talk about sleep training and many other issues that we might encounter when raising our wonderful toddlers. It looks like a question is coming in right now. This question is from Daniela. Hi, Dr. Constant. Our toddler, Kaylee, doesn't seem to be quite ready to give up the bottle yet. Do you have any strategies to help her transition from the bottle to drinking from a cup? Well, Daniela, usually around the age of 9 months, we start to introduce a sippy cup to drink water or maybe even juice. A lot of babies still prefer the bottle, especially for milk, since it is very comforting. But throughout the day, going to the park or maybe sitting at home, you might want to introduce a sippy cup once or twice a day so that they can get used to it and they learn how to use it. That way, by the time they're 12 months of age, they fully understand how to use it, and there will be less difficulty for you to transition from the bottle to the sippy cup. The goal is to definitely get your baby off of the bottle by 12 months of age, not only for developmental reasons, but also for dental issues that may arise when still drinking from the bottle. I hope that helped. This question's from David. Hi, doctor. My wife and I are on opposite sides of the fence when it comes to potty training our 20-month-old son, DJ. I say it's time to get this potty started, but my wife disagrees. Would love your thoughts on this. Well, David, in this moment, I disagree with both of you. You really need to follow the cues of your son. I don't know what cues he's showing, but your son should be able to communicate with you. He should be able to indicate that he needs to go to the potty, and he also needs to be able to understand what to do when he has to go to the potty. A child that's able to communicate with you and walk to the bathroom and actually sit on the potty is a child that's ready. If the communication skills aren't there or the understanding of the potty isn't there, then I really wouldn't push your child, because actually you could have a negative effect in that way. Sometimes you could even prolong the potty training further because they might have been either traumatized or confused or a little afraid to have accidents. So it's really important to make sure that they're ready and that the cues are there. And that way, when you start potty training, they understand a reward system. You want to have them sit on the potty and give them a reward for actually peeing or pooping in the potty. And also, sometimes people forget that your child has to have the dexterity to pull down their pants and pull down their pull-up. If you have to carry them to the bathroom, take down their pants, and then remove a diaper or pull the pull-up down for them, then they're not ready to be potty trained, because remember, the idea is for them to be completely independent. Good luck, and hopefully you both come to an agreeable decision. This message is from Lucy. Dr. Constant, my daughter Camille recently hit the infamous terrible twos stage, and I'd like to know what type of tantrum should be considered a red flag. Lucy, I'm really sorry to hear that you're going through this, and tantrums really can just be stressful, they're frustrating, and they really are exhausting for a parent. I will say that there is no type of tantrum that's considered a red flag. Tantrums themselves or the quality of the tantrum is not the problem. It is what triggers the tantrum that usually would be a red flag. If you have a child that's easily triggered, it does not deal with transition well, does not respond to discipline or even even resistance, like saying the word no to them, and that triggers a tantrum. Those are things that we should be concerned about. Also, when there are very minor situations that don't seem to really provoke anger in other children or provoke a negative response and it provokes a tantrum in your child, that is also concerning. Tantrums are just an expression of frustration from a child because they're unable to communicate effectively. So a lot of times our children don't understand why we are making the decisions that we're making, maybe why we're telling them that they can't do something, we say no, or we take something away. And it's hard for them to understand what's going on because the communication just isn't fully developed yet. And therefore they throw a tantrum. So a child that is even delayed in communication more than what we would expect for their age, for example, might throw tantrums in instances that we might not expect them. So tantrums can be a red flag, absolutely. And it really is a red flag as far as social development and communication. It looks like everybody's really interested in this topic. It is quite difficult to navigate these years, and everybody has different types of advice and different ways to deal with these types of tantrums and somewhat rebellious behavior. Looks like we have a question coming in right now, and it's from Freya. Greetings, Dr. Constant. Besides becoming belligerent and demanding, what are some common developmental milestones for toddlers, and how can we as parents support our child's growth at this stage? Well, Freya, yes, they can be a little demanding, but, like I mentioned before, the reason why is because they are developing their communication. They understand what's happening. They know what's happening around them, but they don't quite understand it. So there's this level of independence and autonomy that's developing, but they're not completely independent. So it's a very gray area. During this time, we're looking for more communication, whether it's 2-word sentences, phrases, understanding, knowing their name and who they are, calling their parents by name and family members by name. It's also about independence, feeding themselves, brushing their teeth, trying to do things on their own, maybe helping you dress them. They might not be able to get dressed by themselves completely independently, but they can help put on a shirt and they grab their shoes and they put them on. And through the toddler years, you'll even see that your child wants to choose what they're wearing and what shoes they want to wear, and they have a preference. And all of those things, while they are great, sometimes as parents, you might push back on that because you have another idea in mind and you're used to basically making all of the decisions for your child and without them having any input whatsoever. So a good way to support your child's growth is to embrace this independence and to give them a little bit of autonomy. If you're getting your child dressed and they choose their favorite red shirt to go with their purple shorts, well, you might not have had that outfit in mind for your child. It's okay to let them choose that and express themselves and show a little bit of independence. That's also a great way to prevent a tantrum. If they're putting on a red shoe with their purple shorts and a yellow shirt, maybe you didn't want them to wear that, but it's great that they're choosing and they are communicating with you and expressing to you something that they want to do. So you should support them and help them with that. So it's just a great way for us to understand what they're going through and what they're learning and what they're trying to develop, and for them to understand that, yes, there are boundaries, but within reason. Here's another question from Milo. Hey, Dr. C, my husband and I have an adorable toddler, Tatum, who is considerably less adorable when it's time to eat. We would love some ideas if you've got any. Well, Milo, picky eating is definitely a huge area of concern during the toddler years. And I can't tell you how many parents are frustrated and sometimes even feel hopeless when it comes to their picky eater. Here are a few tips that we can go over for picky eaters that I usually recommend to my patients. First of all, we want to introduce new foods gradually. You don't want to, surprise them every day with something new and exotic that they're not used to. I usually try to introduce one new food with the meal. So just like maybe a side dish or rather than the main, a side dish or a snack that's different. And then we can give that to them and try it every day for a couple of days until they get used to it and come around and enjoy it. But do it gradually and don't make it such a stressful environment where it's something that they have to eat immediately or they have to eat or they're not going to eat anything at all. We want to do this in a very relaxed format. You want to make meals fun. So, your toddler can even help you by passing you the ingredients or laying them out before you start cooking. They could pick out utensils and maybe stir something if it's safe, and let them interact with you and participate in the meal planning. Because again, from the beginning, meals were supposed to be fun. Cooking and eating is supposed to be a fun family experience. You want to establish regular meal times. That's very important because toddlers really respond to routine. So it's important that you have a regular breakfast, lunch, and dinner time rather than trying to introduce food on the go or whenever you can get it in them, because that, what they want, what they need is a structured environment and a routine. You want them to actually be hungry and want to eat rather than having snacks all day. And then you just try to shove in a lunch or get in a dinner that's pretty much not desired at the time. So a structured mealtime is very important. You want to encourage self-feeding with utensils or finger foods. So I don't know if you've ever tried with your child, you try to do the airplane or put the spoon in their mouth and they just cover their mouth, or they move away, or they make a mess. And that's just their way of telling you they want to do it themselves. They want to be independent. They watch you do it all the time. They watch you eat at home and they want to participate and do it themselves. So give them that spoon, let them hold it, let them suck on a spoon or lick it and play around with it. And then they'll eventually start to feed themselves. And again, it's just much more of an enjoyable experience. So, and if it's finger foods, let them pick it up with their hands and eat it. That's fine. They'll wash their hands later. You don't want to make it such a stressful environment where everything has to be clean and sterile. Let them have fun and explore and touch the food and understand the food and feel it and feed themselves. You want to be patient, but persistent. So yes, you want to be patient. You don't want them to hurry up and finish food in 4 minutes and show them that you're waiting for them and that you're pressed for time. Again, that just creates more stress around eating. It creates a very stressful environment. You want a relaxed environment where we're eating for pleasure. So you want to be patient, but of course you want to be persistent. They can't sit at the table for an hour and a half. Finally, eat together. I know in this day and age, it is very difficult, and all of us have very complicated schedules, especially if there are older kids in the home. But if you could try to at least have one meal together, it really makes a difference. Again, it brings that warmth back. It brings the community back to the table. And there's, studies have shown over and over, not only with toddlers, but even adults, that we tend to eat more when we're eating as a community, as opposed to eating alone. Eating together makes a very big difference. So please try to make an effort to do that. Okay, so we have a question from Corrine. Hi, Dr. Constant. Does screen time on the television, iPad, or cell phone make tantrums worse? How much is too much for a 2.5-year-old? So I don't think the screen time itself makes tantrums worse. It's actually the attention that is given to the screen, and breaking that attention and breaking that moment that they have is what makes the tantrum worse. So as my colleagues at the Mayo Clinic stated, the education level of the content on the iPad or computer is definitely much lower than interacting in person with parents or family or teachers. But again, what is really important to understand is that there is a hypnotic component to the iPad and to the television, and your child is lost in this music video, let's say, or a cartoon that they're watching. And what happens is, as parents will come in and notice, oh my goodness, they've been watching TV too long, or I need to cut this, or we have to go somewhere, or the phone rings and you need your phone back, and you just grab it and then you just break that concentration without any transition at all. Imagine it's just as if somebody dropped a curtain over your head. And that is what really sparks a terrible tantrum. They have no idea where this came from. They were relaxed. They were watching something. They were happy, intrigued, taken off to a very happy place. And then you immediately snatch that away from them and turn it off. And that is very difficult for a child to deal with and to express. Therefore, the only way they know how to do that is with a tantrum. And so to add on to what we saw in the video, yes, you sometimes do have to give an iPad or a phone or a TV to your child, and entertainment is great, and communicating with family via the phone is wonderful, and it's a great way for them to see family that they wouldn't otherwise communicate with, but within reason. We really can't let our children get hypnotized into these overstimulating shows and use it as a babysitter rather than entertainment. So here is a question that's coming in now from Avery. Dr. Constant, our toddler Naomi frequently wakes up in the middle of the night asking to come into bed with us. Do you have any recommended sleep routines for toddlers so we can address Naomi's sleep issues? Well, Avery, I think all of us have gone through this at some point during the toddler years. I think it's a rite of passage as a parent. But yes, if it is lasting too long, then we know that there is a problem. Toddlers, first of all, I think the hardest part is when you transition a toddler from the crib to the toddler bed is when we have a lot of issues at home because they learn that they can actually get out of the toddler bed themselves and they can walk around the room, they can open the door, and they know how to walk to your room. So before they go to the toddler bed, I would always explain to them that the toddler bed is for them to sleep and to relax. And if they do wake up, they can lay in bed, they could stare at the ceiling, they could play with the little stuffy that they're sleeping with, but they're not allowed to actually leave their room. And I think as long as you keep reiterating that, a lot of times children do respond to that because it's just setting a boundary that you expect your child to follow. So a lot of times you can have the little nighttime machines that project the solar system into the ceiling or stars. You can have glow in the dark stickers, just something to entertain them. It is normal to wake up in the middle of the night. The idea is they need to know how to put themselves back to bed. So if they wake up, they have something to look at, they can sing to themselves, they can play with their stuffy, but they're not allowed to leave the bedroom. And you can tell them that you're not allowed to turn on the light and you're not allowed to leave your bedroom. Have a night light on in their room so that it's a safe place and they feel good, but they do have to stay in there and lay in there and they will eventually fall back asleep. Now, if you have a child that's already leaving the room and coming to your room and you have to walk them back to their bed. And you and your partner have to be consistent. The second you let them stay in your bed because you're exhausted and you don't want to go back to their room or you're tired of the back and forth, that is it. They won and they will be in your bed until they are 15 years old. Trust me. So please try to walk them back to their bed, put them back in the room, explain to them, this is a time for you to sleep. This is a time for you to be alone and to rest. And this is a time for mommy and daddy to go to sleep. And as they get older, you can even explain to them that you're tired. You have to wake up early for work. You need your rest in order to be available for them the next morning. These are the concepts that they will understand each year as they get older. So don't be afraid to talk to them and explain why everybody needs healthy sleep and why they need to stay in their room. So it looks like we have a question coming in now. This is from Angela. Hi, Dr. C. We have a beautiful 27-month-old boy who is the light of our lives, but we're about 3 months away from bringing a new baby into our home. Do you have any tips to help us make this transition as smooth as possible? Angela, congratulations on the new baby. That's wonderful news. And 27 months is definitely old enough for your son to understand that a baby is coming into this world. You can talk to him, show him your belly, show him that there is a baby in the belly and that will come out. Explain to him that he is going to be a big brother and what a big brother is. And these are talks we can have every, throughout the week, at bedtime, in the morning. As you're preparing, you tell them you're going to the doctor's office because you're going to see the special doctor that's going to take care of the baby, just so that he is really prepared. And most importantly, I recommend to all of my families to get the Big Brother, Big Sister book. These books are amazing because while you're telling your son that you're going to have a baby and he understands that maybe there's something in your belly, he doesn't quite understand that there's going to be another human being living in his house, in his space, taking up your time. And these books are amazing. They show the role of the big brother. They show the baby in the house. They show mommy holding the baby. So he'll understand that you will now be occupied with another human being in the house that's not his dad. So I think it's great to get these books and to read them. Every once in a while, we put that in the rotation of the bedtime books and just speak to him and be open. And honestly, if you are okay with it, I would even bring him to your ultrasound so that he could see the baby in your belly. Good luck and congratulations again. Hiroshi. Hi, Dr. Constant. Our toddler Takumi is known to occasionally hit or bite in school. Is this considered normal? Well, Hiroshi, this is what we'll call normally abnormal. Obviously, it's not normal behavior to do this. I know that teachers will let you know about it, but it's not unheard of. It's definitely something that toddlers do. It's part of their learning and exploring experience and expressing themselves, and they just don't really know how to express their frustration or sometimes even affection. It could be either or. It could be aggression or affection. So this is something that toddlers tend to do. You really want to try to explain to them if you see it happen or it's happening, show them we want to be gentle. We don't do that. That's not very nice. I really advise against biting them back. A lot of parents feel that if they show the child what they're doing and how painful it is, then they won't do it again. I do not recommend that. And if the teachers, the teachers obviously understand and they handle it at school. So I wouldn't be so down on yourself or upset if your child is biter. Okay, Thea. Hello, Dr. Constant. Why does my toddler behave worse with me than my husband or grandmother or our neighbor, etc.? Thea, we see that oftentimes where a child basically, and this is no offense to you, but a child knows what they can get away with and who they can get away with it. And what that means is that we all set boundaries in a certain way and we enforce these boundaries in different ways. And our children learn very early on who is the enforcer, who isn't, and or who is the one that is a little more passive. So there are certain boundaries that we have to express and enforce and let our children know that we really don't want them to cross. But also, children look for attention, whether it's positive attention or negative attention. So if you give more attention to maybe, let's say, a negative behavior, then they will be compelled to perform that way more and more because they're getting that attention from you. So sometimes even ignoring the child or not even giving what they're doing any importance is even better because they understand that they're not going to get that attention from you. You want them to crave positive attention and affection rather than negative attention. So maybe we should look at the way we're approaching things and the way we're dealing with this negative behavior and compare it to the father and grandmother just to see if maybe there's a discrepancy there. I hope that this helps. Jervis, he wants to know, hi, doc. Are timeouts effective for 2-year-olds? Any other discipline ideas you can share with us? Yes, Jervis, timeout in 2-year-olds is ineffective. It's completely ineffective. I do not recommend it. It just causes more crying, more screaming, and more tension between you and your child. They have no idea. They're going to go commit that same crime over and over 10 times that same day. So as far as discipline, I stop them in the act. I explain why it's wrong and that you don't want it to happen again. And sometimes you can see that they're leading up to the act. And so what you want to try to do is prevent it from happening. Like, I see you. Are you sure you want to do that? I want you over here, not over there. Remember, this toy stays on the floor. It doesn't go over here. So you kind of want to guide them as you're with them and just show them what you expect from them, what behavior you find appropriate. And if they still cross the line and do something, then you need to, at that moment, explain why it's wrong, how we could have done it differently. That's always so important. If you could really explain and flip it and see how we could have done this differently, it really helps as far as making a better decision later. Finally, this question is from Kiko. Hey, Dr. Constant, can language delays make tantrums worse? Yes, as I mentioned earlier, not language as far as idioms, but more of a speech delay. Speech delay actually absolutely makes tantrums worse. Why? Because the child is unable to express what they're feeling. They're unable to really communicate and understand what's going on in that particular situation. And so the easiest response is to get angry and lash out and just start screaming. And so, yes, if we're concerned about language delay, speech delay, then please, look at these tantrums and try to get help and speak to your pediatrician to see if we can get therapy for your child. I hope that this was helpful and have a great day.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.